Hello, good afternoon, everyone. Hi, this is Dr. Jasman from Health Metrics, and then we have Dr. Sean for Saver of Life. I'm Jason for Health Metrics as well. Thank you, everyone, for attending this session. We will discuss topics relevant to hypertension today because it's in conjunction with World Hypertension Day. So this topic, although it's on hypertension, but then if you do have questions which is not relevant to hypertension like NCD, that is also good to know. If you really want to ask, we will be having both doctors here to explain to you the situation. So from here, then we're going to, before we start the session, we will just show you one statistic or infographic that you will be seeing. This is the statistics or infographic for the employee in Malaysia. Okay, from here you'll be able to see it's all more relevant to NCD and not just limiting to hypertension. It's because it is one of the most critical stuff that is affecting a lot of people. As you can see from here, 1 out of 5 has diabetic in Malaysia, and this we are talking about the Malaysian statistic as of 2019. Yeah, 4 out of 10 has high cholesterol, and then you have 3 out of 10 that's hypertension. Okay, so you can see here, diabetic, cholesterol, and hypertension all are something that is affecting people in the long run. Then also you can also understand that why is this catching up or increasing? Partly due to the what we call inactivity of the work environment. Most people, especially if you are now working from home, is even higher chances that you are physically inactive. As you can see here, there's already at least 64% are physically inactive, 90% are not eating the right diet, and 50% are stress related. So this is the statistics that we're going to share with you, and this will impact your staff, will impact the productivity, as well as impact the whole company's budget on medication or medical coverage. So all this will impact you in the long run, impacting also those who are offering insurance, because the insurance premium will go up as long as the claim is going up. Yeah. Okay, let's go into the session. We will go for question number 1. But before that, then let me explain what's the different role of these two doctors here. Dr. Jasman will be explaining more on the, what we call modern medicine's perspective, whereas Dr. Sean will explain a bit of the other approaches. It's still science-based. It's just that he's not just emphasizing on medications. He's also giving you an alternative approach that you can improve your health conditions. Yeah, that's why both doctors will explain on a different perspective, different angle. Okay, question number 1. What exactly causes a person to get hypertension? Is it genetic, diet, or lifestyle? All right, so maybe you start with Dr. Jasman.
Okay, thanks, Jason. First of all, hello everyone, and thank you for joining our session today. So hopefully everyone already had a good lunch and can lend your ears for this talk. So as what Jason mentioned, today's talk is about hypertension, but also not confined to just hypertension. We can also talk a bit more about NCDs, which is non-communicable disease. So these 3 non-communicable diseases, what Jason mentioned just now, it's mainly comprised of diabetes, high cholesterol, and what we are going to talk today is hypertension. So for the purpose of the explanation on the hypertension, probably I would like to go using the framework of 5W and 1H. So which is which, what, why, when, who, and how. So first of all, I would like to touch base on what is actually hypertension. So hypertension, as you guys know, is basically elevated blood pressure. Okay, so if I am to ask everyone what is the normal blood pressure, I think everyone would know it's around 120/80. So that's the normal range for blood pressure. Any readings lower than that, meaning up to down to 90 to 60 is still considered normal, but lower than that is hypotension, in which is a different different thing altogether. However, if let's say your blood pressure is above 120 to 129, and also above above 80, so these two readings is what we call elevated blood pressure. Okay, so elevated blood pressure means your blood pressure is being elevated, but you are not yet being considered hypertension yet. Okay, so those that are considered as a stage 1 hypertension is basically for those reading of 130 and above, which is 130 to 139, and also the diastolic reading of 80 to 90. Sorry, I forgot to mention, whereby in the blood pressure, I assume everyone knows that there's two readings, which is the systolic and also the diastolic. So the systolic is what I mentioned, the first reading, which is the 120 reading, and also the diastolic is the next one. Okay, so what the difference between systolic and also diastolic? So systolic is basically when the blood is when your blood vessel is being contracted, when the heart is pumping your blood. So this is basically when the pressure is the highest. Okay, that's the meaning of systolic. But the meaning for diastolic is basically when your heart relaxes, and also when the blood vessel is being relaxed. So that's why the reading for diastolic is lower. Okay, so we touch base about the normal reading, the elevated reading, and also the stage 1 is basically more than 130 to 139 and 80 to 89, and stage 2 is basically for 140 or above, and also more than 90. So I think these readings of blood pressure, you can actually just Google up, because it's all over the internet, and I assume everyone can just Google what's the normal reading for blood pressure. Okay, so the next one is why. Actually, the most frequent question that we doctors always receive is, why do I get hypertension? Okay, so this will touch base on the cause of what actually caused the hypertension itself. So it's actually it can be genetic, and also it can be due to your environment. So this is what we term as the modifiable and also the non-modifiable risk factors. Okay, so I will go into the non-modifiable risk factor, in which basically something risk factor that you cannot modify, which is basically genetic. Okay, how do you know that you might have that increased risk of hypertension due to your genetic? Is basically if let's say your parents or maybe someone in your family have hypertension before. So basically, if let's say this also same goes to diabetes as well, and also high cholesterol, in which if let's say in your family there's someone with diabetes or hypertension, you yourself will be at risk of having hypertension as well. So this is what we call a non-modifiable risk factor. Okay. However, the most common cause of hypertension is basically the modifiable risk factor. Okay, the environment part, in which basically if we were to categorize this, is basically depends on your diet and also lifestyle. Okay, so let's go to lifestyle first. All right, so for lifestyle first is basically your physical inactivity. Okay, so basically lack of exercise is one of the common cause of hypertension, in which usually your body is being sedentary, it is not being really active, so it makes it makes you become more I would say lazy sometimes, and this may increase the chance of you getting hypertension. Also, on your diet itself, so basically the most implicated food is salt. Okay, so when we consume salt, is basically what's the component inside salt itself. it is basically sodium. Okay, so sodium, when you consume a lot of sodium, you are actually retaining more water inside your body. So because of the more water retention inside your body, so it makes your heart pump much more harder to basically circulate the blood inside your body. So because of that high pressure, on the long run, so basically it makes your the blood vessel to become much more stressed and will then lead to being hypertension. Okay, so basically these are all the why, I would say, in which the risk factors for hypertension. Okay, then the next one is how. All right. So the most common question is, how do I know whether I have hypertension or not? Okay, so there is a reason why hypertension is called the silent killer, in which basically hypertension, people wouldn't know that they have hypertension for years until it's too late. Okay, until they have complication that arise from hypertension itself. So basically, usually hypertension, sometimes it is an accidental finding. Okay, for example, let's say you go to a GP for viral fever, for example. And then, as you know, when you go to a GP for viral fever, they will check your temperature, they will check your heart rate, and also they will check your blood pressure. Okay, sometime during that time is basically when the GP will detect, oh, patient A, you actually, your blood pressure is actually elevated, or maybe there's a sign of stage 1 hypertension. So that's how actually a doctor usually detect whether the patient has a high blood pressure or not. And sometimes, usually, I think some companies, they do have the benefit for health screening, or maybe the patient itself is more proactive in managing their health. So they go for a yearly checkup. Okay, so when they go for a yearly checkup, at that time when the doctor checked the blood pressure, then they found out that the blood pressure is high. So usually hypertension, the message here is hypertension, it is a silent killer. You don't actually know when you have hypertension unless you get it checked properly. Or maybe at home you have home monitoring, home blood pressure monitoring. It is when you use that machine, the blood pressure machine, then itself you know that you might have elevated blood pressure. Okay, so I think that's all for
okay. Thank you, Dr. Jasman. Yep. Now I pass to Dr. Sean. What is your comment on this? Why or what's the cause?
Yeah, thanks, Jason and Dr. Jasman for that. You know, I just want to thank everyone for coming on. And truly, I think World Hypertension Day is I mean, hypertension as a disease is definitely something that that is something that I'm very passionate about. And you know, in the field of lifestyle diseases, there is like the reason why it means so much to me is because you know, lifestyle diseases is a disease that is related to lifestyle, which means that it is very much preventable. It's very different from an infection. It's very different from, you know, diseases or injuries that are caused by, you know, events. But when it comes to lifestyle, it is something that, you know, it develops over time, and it's something that, you know, choices that we make over time that add up. And so, you know, these things are very much preventable. And the fact that we are spending so much money, so much resources unnecessarily, really hits a point for me, and you know, I just want to thank Health Metrics and Jason and the rest of the team for organizing this. I think Dr. Jasman, you covered most of the points, and you know, the key understanding of hypertension or high blood pressure. Sorry, and I think the maybe the only thing that perhaps I could add is that there are some cases of hypertension which we would call a secondary hypertension, which is a result of another condition. You know, so that is very different from the hypertension or the high pressure that grows over time, as Dr. Justin was talking about, right? It is a secondary hypertension. What that is, okay? Secondary hypertension means that you have an existing condition that is causing you to have the hypertension. And I give you some examples. For example, if you have kidney failure, for example, that is unrelated to your high blood pressure, but because your kidneys have failed, your blood pressure is high. Some other examples like obstructive sleep apnea. Many people struggle with that, right? They are unable to sleep properly, and so therefore, if you cure the OSA or the obstructive sleep apnea, the hypertension heals itself, right? Secondary hypertension. Some other conditions are like thyroid, right? If you have high thyroid readings, naturally you have high blood pressure. Now your problem is not high blood pressure, your problem is thyroid, right? Adrenal gland sicknesses as well, and also diabetes. Diabetes does result directly correlated to high blood pressure. And so if you cure the diabetes, your high blood pressure resolves itself as well. So I think this is something that just wanted to add to what Dr. Jasman has mentioned. And I would like to also agree with what he said that yes, there are secondary cases like these, like what I just mentioned, but primarily most of the hypertension that we're seeing these days in our community as a result of modifiable causes and the choices that we have made.
All right. Thank you, Dr. Sean. That's very important point that Dr. Sean brought up. It's not necessarily a primary cause. It could be a secondary. So find out from your doctor what is the cause first. Don't just quickly jump into hypertension. It could be caused by your kidney issue and other things like thyroid. So, so Dr. Jasman, what complication can arise from these conditions? And with the current pandemic, COVID-19, would they be also be exposed to higher risk?
Okay, sure. All right. So basically, first of all, everyone needs to understand whereby hypertension is indeed a killer. It is basically the same like diabetes as well. It is a silent killer, insidious, meaning it basically destroys your body very slowly until to the point that suddenly you felt symptom. It is when it is too late. Basically, it's still preventable, but it's more towards the too late stage. Okay, so basically the complication for hypertension can be basically divided into your heart, your eyes, your kidney, and your brain as well. Okay, so because of this overload of pressure inside your blood vessels, so basically what happened to your heart? So because of this high pressure, your heart have to basically work overtime, basically. Okay, so your heart need to pump a lot. Okay, you need to pump more pressure in order to get up and also circulate the blood inside the body. Okay, so everyone need to understand whereby the heart is a muscle by itself, and also blood pressure is basically there's a lining of we call smooth muscle. So heart and also the blood vessel is actually muscle. Okay, so I want you guys to imagine whereby what happens if you go, like let's say you go to a gym, and how do you develop your bicep? It is basically you give stress, a lot of stress, isn't it? A lot of stress, and then that's how your bicep will become hardened, sort of like that.
Yes.
Okay, so basically this also happened to your heart as well. Okay, so because of the constant high pressure to your heart, it become enlarged, it become thickened, it become less elastic, basically. So because of this, your heart will become so because of this, your heart, especially on the left side, okay, the one that pump out the blood, so it become thickened, it become less elastic, and then the volume of the blood will be affected. So because of that, if it's not being treated, it will eventually lead to heart failure. And also heart failure is treatable. Yes, it's treatable, but it definitely will reduce your quality of life. Okay, so that's number one about the heart. And then on the brain itself, okay, so on the brain, basically because of that constant high pressure to your brain, shoot up, tum, like that to your brain. So basically what happened is maybe it can lead to aneurysm, or it can lead to basically stroke. Okay, ataupun in Malay called angin ahmar. All right, so it could be because of that too much pressure in the long term to your brain. I mean to the blood vessels in the brain. basically sometimes it can burst and cause bleeding, or some of the blood vessel to your brain can be blocked as well. So basically, this is the danger part of having uncontrolled hypertension. Okay. So, and then to the kidney is basically whenever, because of this constant high pressure of the blood towards the kidney, you have to understand whereby the kidney blood vessel is very, very small. Okay, because of that constant pressure to the kidney, it will cause the kidney to overwork, and then will eventually lead to kidney failure as well. And then to the eyes, yes, I forgot to mention to the eyes. So there's a condition called it is a retinopathy. So basically, retinopathy is basically it is caused by damage to the blood vessel inside the eyes. So what are the causes of this damage inside the eyes? Basically because of the high pressure inside the retina, which is one of the layer inside your eyes. So it can eventually lead to blindness as well. So that's the reason why hypertension, it is a silent killer. It is insidious. It is also similar to diabetes as well.
I see. How would this be more impact during this pandemic period? Are they at higher risk?
Okay, all right, sure. Okay, so now because of this pandemic issue, is basically these people with hypertension will be considered as high risk patients. So because of this high risk patient, to make it simple, they are much more prone to get complication due to COVID-19 infection. Okay, so basically whenever if let's say a doctor receive a patient that is positive for COVID, and then the patient has risk factor, which is hypertension. So straight away, this kind of patient will be categorized as high risk patient. And then also the complication due to that COVID-19 infection can be much more severe as compared to patients that do not have any hypertension.
I see.
Yes.
Okay, thank you, Dr. Jasman. Dr. Sean, you have anything you want to add on the complications from these conditions?
No, I think Dr. Jasman covered all of it.
Right. Okay. Thank you. So we will move to the next question. And what can I do if I'm newly diagnosed with this hypertension? So maybe this round we pass to Dr. Sean to answer this first, and then we go back to Dr. Jasman.
Yes.
Okay. Thanks, Jason. I think the first thing, well, basically what this question is asking is, how do doctors, or at least what you're trying to find out is, how do doctors approach hypertension, right? What happens to me? Other than medication, what else the doctors will suggest me to do? Yeah. Now, I think the first thing that I want everyone to understand is, when it comes to treating patients with high blood pressure, the doctor's concern, or the number one concern, is how do I prevent you from coming back to me the next 10 years with a stroke, a heart attack, a heart failure, or kidney failure? All right. So so this is the first thing that you must remember. So this is how we approach the treatment. Yeah, because as Dr. Jasman pointed out, right, the hypertension is directly correlated to these few problems: a stroke, a heart attack, a heart failure, or a kidney failure, or eye visual damage, right? So these are our considerations. Now, and as we rightly pointed out in the first question, right, our blood pressure needs to be within a certain range. Anything above that is damaging to the body, right? So there are a few ways that doctors will suggest you to manage this condition. Now, firstly, they will try to gauge your risk level. Risk level for what? Risk level as to whether you'll come back in 10 years with a condition that will kill you, right? If you get a stroke, right, it can be potentially fatal. A heart attack is potentially fatal, right? Kidney failure is also a long-suffering and also a fatal disease eventually when your kidney completely fails, right? So doctors want to prevent that. So if you are kind of a high-risk patient, in this sense, they will immediately put you on medication. Why? Because they are worried that not just 10 years, but maybe the next year, you will need to go to the hospital on the ambulance and be in the ICU. They don't want that, right? So immediately they put you on medication. Now, if your risk is medium or low, then they will suggest what they call a lifestyle intervention. And there are differing amounts, or there are differing ways as to how this is executed, the lifestyle intervention. But in a nutshell, what it is try to modify your environment that has brought you into this condition with the high blood pressure. All right. So I think we'll go into more detail, I believe, in the further questions as to what are the some different lifestyle interventions that is recommended that we can do. But these are I think the few considerations that you must understand from a doctor's perspective. We want to prevent you from coming back with a very severe form of disease, and that's why we give the medications.
All right, thank you, Dr. Sean. So, Dr. Jasman, what will you add on to this?
Okay, so I think Dr. Sean has covered most of the answers for the question. So basically, what you can do after you're getting diagnosed, apart from the medication that your doctors prescribe, you need to basically have I would say maybe a self-audit. I would say so. This is what I do to myself as well. In which I just want to share my personal experience. It's not that I have hypertension, but I do have elevated blood pressure before, and also my heart rate is on the high side, and also even my blood sugar as well. So that was about 5 years ago, in which I was very obese. I would say I was obese, around 99 kilograms. And now, after I did a health screening, yes, I did a health screening basically. I did health screening on myself. That's how I know my blood pressure is on the high side. And my blood sugar is basically what we call pre-diabetic. Yeah, pre-diabetic, and also heart rate is on the high side, about 80 on average. And also my blood pressure is elevated. If let's say we go to the guideline now, which is more than 120/80. So my blood pressure is more like 125 and around 89. 89, yes. That was 5 years ago. So basically, I just sharing my personal stories. Yeah. So basically, because of that, I did basically the doctor also treat another doctor also. Okay. So they suggest for me to take some medication. You see, because of this, because it depends on the doctor whether they want to start medication or not. So basically, either you do that, or you I remember he mentioned that or you do a self-audit on yourself, self-audit, and really deep dive into why you are having this kind of thing. And then he also mentioned, don't make it complicated, make it simple. Okay, so basically make it simple, whereby you see yourself. One of the cause of this I would say all this diabetes, hypertension, high cholesterol is basically you look at yourself, your weight, isn't it? So when you are basically you are obese, it is actually one of the biggest risk factor for developing that kind of diseases. Right. So I can tell you this story for 1 hour,
but we don't have so much time.
Yes, but to cut it short, I did a self-audit on myself, and because of that, it triggers me that I need to really modify my lifestyle, which includes what I eat, what I put inside my mouth, and what I do. So basically, I assume maybe later on Dr. Sean can explain more on that.
Right.
Okay.
So maybe Dr. J, since you say about self-auditing, probably you can explain what do you do, like how often do you measure your blood pressure, when should you measure your blood pressure, so to have a better reading about it.
Okay, all right. So that's a question as well on when to measure the blood pressure. So basically, usually it's recommended to measure 3 times a day. Right, so the first time is basically when you wake up in the morning. Okay, when you wake up in the morning, you take maybe you relax first, and then you take a shower, and then after that you take your blood pressure. It's when you feel much relaxed. Okay, then the second time is basically maybe mid-afternoon, probably after you have a lunch, or maybe before lunch, whereby you much relaxed at your workplace, for
Okay,
example. Okay,
right.
that's the second one. And the third one is basically at night, maybe I would say just before, maybe 1 hour before you are about to go to sleep, when you are really at rest. So basically, this is the three I would say timing that you can use to measure your blood pressure.
Okay.
The message is basically when you are at rest.
Right,
Yeah.
right. Good, thank you. So we'll move to the next question. Can we actually prevent hypertension on the food or diet that we alone? And can we reduce it by just changing all this, what we take, what we eat? Yeah, so maybe this one we'll let Dr. Jasman start.
Oh, okay. So basically, I think this is Dr. Sean's expertise on food lifestyle. But as I mentioned, basically on prevention part, it basically comprised of, I would say, two category. Maybe usually if let's say you are not yet being diagnosed with hypertension, so what can you do to prevent yourself from getting hypertension? Okay, and then the second prevention is basically if let's say you are already being diagnosed with hypertension, what kind of basically food or diet that you can adopt in order to prevent complication of the hypertension. So basically to make it simple, is basically in terms of diet, it's the sodium itself, the salt, the table salt that you are consuming on daily basis. So basically, my personal mantra is try to make it simple, don't make it complicated. If let's say you want to prevent, let's say you in terms of salt, so you have to reduce the salt intake. Okay, so really reduce your salt intake, because basically salt is everywhere. Okay, basically in fast food, and then also in I would say in mamak food lah, in those nasi kandar, everything. Even sometimes even the rice itself, they cook with salt as well to make it sedap, isn't it? So memang sedap, yes, memang
nice
sedap,
food,
but but in the long term, basically if you make it a habit, then it will become a problem. So once in a while it's okay, but if you consume it on daily basis, then it will become a problem.
Right.
Okay.
Right. Okay. So, Dr. Sean, do you think that those who are also consuming alcohol or smoking, would they also increase the risk? And what is your opinion on this?
Yes, actually, if you look into the recommendations, even from our Ministry of Health, on the list of risk factors, they do list these things. Yeah, tobacco, alcohol, and also what's the third thing you mentioned? Tobacco, alcohol, and fats. Right, these are things that, well, fats not mentioned, but tobacco and alcohol is mentioned. Yeah, so the short answer is yes. These things do contribute to the development of high blood pressure. Just commenting on the salt intake that Dr. Jasman mentioned. Yes, definitely, salt intake is a problem with our modern civilization. Yeah, I mean, in our program, we have one 2-hour talk dedicated purely to salt.
Wow, 2 hours.
Because if you really go and dig into nutritional labeling, how they hide the sodium, right? And how in our diet now, we are consuming way above. Like if you eat a conventional diet, meaning like you order in from a conventional food stalls and you eat more or less prepackaged sauces, and in your cooking, and when you cook also use a lot of prepackaged stuff, you can be absolutely sure that you're at least 4 to 5 times above the recommended intake. Even before you even reach for the salt container to put it in, you're already above. That's why it's no surprise that we have such a big problem on our hands right now. And then there are different ways we can approach this, but from a personal individual basis, how do I what do I do to reduce my salt? It's actually quite straightforward. You need more awareness on how much salt is within the food you normally eat, and this is not hard. Like for example, right? Like Dr. Jasman said, nasi kandar, right? It's really easy. Our nutritional department, in KKM has done a good job. They have gone through and really go and label. If you Google, a Hypertension Malaysia guideline or salt in our food, Malaysia, this kind of combination of keywords, and go to images, you'll find lots of infographics showing you, and I'm giving you the shortcut here, yeah, show you lots and lots of beautiful infographic, right? Satay, how much sodium? Nasi lemak, how much sodium? Your Maggi goreng, your Maggi curry, everything. It's a Malaysian stuff, and that's very, very relevant, I think. And I think the other thing that I want to mention here, since you're talking about prevention, right? Meaning somebody who isn't on medication now. I can share with you actually two of our patients that went through recently this year, our program. They came in with borderline, elevated pressure, but not full blown. But one of them was struggling with obesity. Yeah, his BMI was in the 40s. Yeah, 42. So these two people, we got them on, and it's the funny thing is this, okay? Everybody knows what you need to do, yeah? When it comes to a healthy lifestyle, everybody knows, or majority of us already know, right, what we need to do. What do you need to do to be healthy? You need to exercise, right? We all know that. Do you need to eat fruits and vegetables? Yeah, we all know that. Do we need to sleep early? We all know that.
Exactly.
It's not a question of education almost, I would argue. But it's a question rather of motivation, perhaps, and awareness. We know it, but are we aware of the effects of a simple decision such as sleeping at 10 p.m. versus sleeping at 1 a.m.? And I know these two things are what we focused on, I think, for at least for these participants that wanted to reduce their blood pressure. And just to encourage everyone, within 10 days, right, we got both of these people down. From high 130s down to 120s, and just in just 10 days. And did we staff them? Did we, no? Very simple, right? Got them to do the things they were meant to do, right? But with the motivation that they needed, and that's kind of, I think, a motivation for anyone who has gone through a screening, and you see that my pressure is 135, 139. 85, 86, 91. Oh, I'm getting a bit scared, right? There is hope. Okay. And I guess the follow-up question would be, if we can prevent, then how do we what if let's say you have already diagnosed hypertension, right? Correct. Yeah. So that was in the prevention side. But when it comes to the reversal side, like we mentioned previously, right? When it comes to treatment, the goal of the doctor is quite simple. We don't want you to come back with a severe form of disease. So we give you medication to control your blood pressure immediately. So this is what I find a lot of patients don't understand. They think that when they eat the medication and then their blood pressure become okay, then it's okay, they can stop eating. That's not true.
Yeah, right.
That's true. Because remember, the point of the medication is to control your high blood pressure, meaning that you have high blood pressure. So if I take away the medication, your blood pressure will just go back up, right? Why does it go back up? Because you didn't deal with the cause of it, right? Which is your wrong choices, right? Your wrong lifestyle choices. And so what is the simple answer? How do we reverse blood pressure? Very simple. We need to change your lifestyle. And there is also, again, when it comes to blood pressure, there is a long session on that where we talk pretty much in detail. But if I were to try to summarize the talk, there are 4 main studies actually that address the reversal of high blood pressure. They are the China study, the 7-country study, the dietary approach for stopping hypertension or DASH study, from which the DASH diet comes out, and finally the study that talks about the Mediterranean diet. Yeah, so these four things. And in our talk, actually, we show in our session we show the correlation between these 4 landmark studies, which is people actually return to what we call whole unprocessed foods. Yeah. So how do we reverse? How do we prevent? Yes, we need exercise. Yes, we need to stop drinking alcohol. But these are all topics in itself, right? Addiction and all that. But the first and foremost thing that you can already start doing is increasing your intake of whole unprocessed foods. And if you're hypertensive, right, Google up the DASH diet, DASH, DASH diet, the Mediterranean diet, and I guess you can read the China study as well. But yeah, in a nutshell, can we reverse? Can we prevent hypertension? Yes, but you need the motivation and you need the right knowledge as well. And so, that's what we found, and if you have these two things in place, we have found that it's actually pretty, reversing high blood pressure actually is pretty easy. It's the other conditions like cancer, like heart failure, all these things, those are harder to reverse. But hypertension and diabetes, if addressed early with the right motivation, the right program, the right people dealing with it, really easy. Within 2 to 3 weeks, you can see a difference already.
Right, thank you, Dr. Sean. So basically, here we have known that most of these diseases is all lifestyle related, not so much of genetic as we all know. So if you're interested to know how you want to reverse more, you can get in touch with Dr. Sean later, and then we will probably set out another session, like you say, talk about hypertension and the diets and how we can reverse it in the next session. Yeah. So most people do not have symptoms hypertension, Dr. Jasman. So is there any really pre-symptoms or what else can they do if they really want to know, are they having any hypertension?
Okay. So as I mentioned before, hypertension is a silent killer. So it can go undiagnosed for many years, maybe up to more than 10 years perhaps. You wouldn't know that your blood pressure is already on the elevated side, and then if let's say you have elevated blood pressure for let's say 5 years, and then without being noticed, it can progress into stage 1 hypertension. Okay, so this is quite common phenomena worldwide, in which even for myself, I wouldn't know that I have elevated blood pressure because I don't experience any symptom at all. Okay, so basically, like I said, usually people will know that they have elevated blood pressure or even hypertension whenever they go and visit the doctor for something else. Let's say just now I mentioned they went to see the doctor for viral fever, for example, and then the doctor measured the blood pressure and found out, hey, your blood pressure is on the high side. Or ataupun the blood pressure, hey, your blood pressure is very high lah. Have you had any symptom like pening kepala, or maybe sometimes your vision is a bit blurry, or maybe you are easily fatigued, or things like that. So number one is usually accidental findings during the visit. And basically the number 2 is basically whenever that you are required to do a medical checkup, for example, pre-employment. That's when suddenly you found out that your blood pressure is high. Or maybe you go for you have a benefit for health screening yearly checkup. So that's when the patient, he or herself will catch that day, hey, I have my blood pressure is elevated. So basically, the main point that we would like to stress out is basically, please do your health screening at least once a year, or please at least check your blood pressure once a year. Maybe for the adult working population, you can invest in the blood pressure machine. It's not that expensive. Just have buy one machine and just regularly check at home. Basically.
Right. So it's recommended to do at least once a year health screening to find out whether you have any health conditions or not, right?
Yep.
Okay, Dr. Sean, anything you want to add on?
I just really want to second what Dr. Jasman just said. When we first started doing this, getting involved in this lifestyle medicine and all that, we went a bit crazy with our health screening. We did about 170 health events in like 3 months. We screened, but from there, we screened more than 1,000 plus corporate workers. And it astounded us when we saw that if you are between 18 and 55, and you're a male, it's literally 1 in 2.
That's 50%.
Yeah, 50%.
1 in 2.
And that was really surprising to me, because from what I know from the morbidity survey, it's only 30%. But then when I dig deeper onto the morbidity survey, they also estimate that 60% is undiagnosed, which means that if you do all the calculation, it's about 51% of the population, which is correct. So which is scary, yeah. So if you as a HR or you as a CEO or management of any company and you see your claims, right, like it's like 10%, that's not correct. That means that there are some hidden hypertension there, and so that's why screening is so important. And like Dr. Jasman said, you will not know anything until he comes in with a heart attack or a stroke. Yeah,
that's true.
Yeah.
I think the statistic is not as accurate is because a lot of people, they never do their health screening.
Yeah.
Therefore, they cannot capture the actual statistic that these people are actually at already hypertension or pre-hypertension. Okay, so we are almost running out of time. We're going to go through a few questions that attendee has posted so that we can go through some of the questions more relevant. Let's take a look at the Q&A submitted and see how some of the questions that Dr. Jasman and Dr. Sean can answer.
Okay.
So just show the Q&A and okay.
Okay, so this is a question from the floor.
Yes,
okay,
there's a question from the floor. Is our emotion contributing to hypertension? Example, like having a stressful workload at office. Dr. Jasman.
Okay, so basically, I think I forgot to mention just now about the why do you get hypertension? Okay, is basically psychological factor is one of the modifiable risk factor. Okay, so basically, if I am to answer this question, is our emotion contribute to hypertension? The answer is a resounding yes. Okay, because if let's say you are stressful, if let's say you're stressful hari ni only ataupun besok only is still okay. But if let's say you are stressful most of the time, meaning let's say you work 5 times a day, then basically 5 times a week. Let's say in the 3 days in the week you are being stressful, then that's basically one of the you are at increased risk basically at increased risk of getting your blood pressure elevated. Not necessarily hypertension, but your blood pressure will basically become elevated basically. So the answer is definitely yes.
I see. Dr. Sean?
I was just going to say that, yeah, you're right. It's actually very simple. You stress at work, you cannot sleep. You cannot sleep, you stress some more. Then after that, what you do, you go to the kitchen, you take some chocolate and try to eat. And then next day, you continue being stressed, you cannot sleep, and then your baby cry, got problem, this one, that one. There you go, you get your hypertension.
So it's a compounding effect, yeah, or the stress level is another contributing factor. So beside the sodium and things like that, so do manage your stress. It's very important to manage your stress as well. Let's go for the second question, yeah. It says that if we can maintain a healthy lifestyle, we have a good blood pressure, can we stop the medications? As the attendee's question is, I'm actually a hypertension patient right now. I'm taking the medication right now. But if they have improved on the blood pressures, can he stop medication, Dr. Jasman?
Okay, sure. So I think for this question, the one that posed this question is basically on medication.
Yes, on medication.
So basically, I will answer, can we stop having the medication if let's say we maintain a healthy lifestyle and good blood pressure reading? The answer is a no. So because you wouldn't know whereby the good reading is basically, is it because of your lifestyle or is it because you are on medication? Okay, so basically the answer is no. However, if let's say you want to let's say you are planning to stop or you are thinking about stopping your medication, the first step is basically to discuss with your doctor. Okay. So basically, your doctor will assess with you. Okay, let's say you say that you already maintain a healthy lifestyle. So your doctor will assess how healthy is your healthy lifestyle right now. So sometimes you may think that you already have a healthy lifestyle, but your doctor may think otherwise. Okay, so basically, the answer for this, no. Because if let's say you abruptly stop your medication without consulting the doctor, you can have what we call a rebound hypertension. Okay, rebound hypertension meaning suddenly your blood pressure shoot up to a much more higher than before. So the answer is no, and speak to your doctor before you want to do anything.
Right. Dr.
Okay.
Sean, anything to add, Dr. Sean?
Yeah, I agree. We are not your attending doctors, so we cannot give you the permission to stop your medication. But I'm seeing here that you're telling us that you're on 5 milligram coveram, which is perindopril, which tells me that your condition is not very serious. So what that means is very simply, if you're thinking of stopping a medication, you need to discuss with your doctor, right? Tell him that you want to, taper off your medication. And make sure that you find a doctor that is supportive, and you will be able to taper it off with the doctor's instruction, and making sure that truly is a healthy lifestyle that is lowering your high blood pressure.
Right, thank you. So bear in mind, don't simply stop your medications, consult your doctor first, and then the doctor should normally advise you to slowly reduce the medication, and then see how is like what Dr. Jasman said, are you really having a healthy lifestyle?
Yes.
Are you really eating the right stuff? Not just because of the medication.
Yes.
Some people always think that I'm under control. When I'm taking medication, I am good, right? Okay, let's go to see here. There's a question saying that can someone with hypertension get pregnant? What are the risks to be considered? Dr. Jasman?
Can someone with hypertension? Yes, definitely. Hypertension is does not directly cause you to be infertile, I would say.
Mm-hmm.
Okay, so however, if you get pregnant and you also have hypertension, definitely you cannot follow up with a regular GP clinic.
Right.
You have to have a follow up with obstetric and gynecology consultant.
Mm-hmm.
Because you basically have a high risk of getting complication later on.
Right.
So yes, you can get pregnant if you also have hypertension.
What kind of complication would you see on
so
this?
basically, number one, it will worsen the hypertension itself. Okay, it can cause problems such as preeclampsia and eclampsia.
Okay.
So this is basically sort of like emergency in pregnancy, right. And it can basically lead to death if left untreated.
I see.
Okay.
Right,
Yeah.
right. So Dr. Shen, what would you add on to this if they are really pregnant and at the same time is having hypertension?
Yeah, I think Dr. Jasman covered it very well. Hypertension does not prevent you from getting pregnant, but when you are pregnant with hypertension, then there are risks for that. Namely, like he mentioned, the increased hypertension some more, and issues during childbirth, which he mentioned, preeclampsia and eclampsia. These are very, very real problems, and so those are the risks that you need to consider and discuss with your gynecologist.
Right. So the message here is that if you can, make sure that you control and improve your health condition first before you get pregnant. But if you already get pregnant and you have hypertension, consult your specialist, because they are the one who can help you throughout this period of time. Yep. Right? So we move to the next question. Is migraine one of the symptoms related to hypertension? What do you think, Dr. Sean?
Migraine is not one of the symptoms, neither is it related to hypertension, but headaches can be a symptom of hypertension.
Maybe you can explain a bit to some of the attendees what's the difference between headache and migraine.
Yes.
Okay, migraine is when you cannot find any other reason for your headache. Yeah, and even then, migraine is a very how I put it, it's a non-specific type of diagnosis, meaning that we have already ruled out everything else. Yeah, you got no hypertension, you got no tension, no emotional, but you're having migraine, and there are certain symptoms that are specific to migraine. Yeah, so unless a doctor has specifically told you you have migraine, be careful of putting yourself into that category of having migraine. So migraine is a specific diagnosis. Yeah, it's different from a normal, like, oh, you're very stressed or you didn't sleep well, got headache. It's different. Yeah, it's a different thing. Now, question related to hypertension: can headaches be a symptom of hypertension? Yes. If you have very high, very high blood pressure, can it cause you to have headache? Yes, it can. But that's, in my knowledge, that's the only connection to hypertension. And that's different from the diagnosis of migraine, in which it's a separate thing.
Right. Thank you. So Dr. Jasman, there are people saying that migraine is always like when you have headache in a certain area. Is that true?
Yeah, so basically that what Dr. Sean mentioned just now, migraine itself is a separate diagnosis. So migraine, there's two types, classical and also common. So migraine is basically the symptom is much more well defined and it different from the headache that is associated with hypertension. So the ones that associated with, let's say, hypertension is much more like a tension headache, where you feel like your headache like a headband on your head.
Right.
Whereby migraine is basically sometimes you get the headache on maybe on just the left side or right side of your head. So it's kind of different.
Okay.
And also what Dr. Sean mentioned just now is migraine is whereby it's been diagnosed after you have ruled out everything else.
Right.
Maybe because whenever that let's say a patient come in with a headache, definitely the doctor will check your blood pressure first.
Sure.
Let's say when the blood pressure is let's say normal, and the doctor will try to elicit and also check what are the symptoms of the headache itself. And if, let's say, they already ruled out everything, then maybe the doctor will conclude that this is basically probably a classical migraine, for example.
Right. Okay. So the message here is that don't be doctor yourself. Don't just go and Google and then find the symptoms and then decide, oh, this is your symptom and this is your disease. Always consult your doctor. Your doctor will be the best person to tell you what is your current conditions. Okay, everyone, we are running out of time, so we're going to conclude this webinar. But before we conclude, we're going to share with you some of the current offers that we are giving to the attendees for participating in this webinar. So there are 3 offers in total. The first offer that we're going to share with you is that there's this e-pharmacy by Health Metrics. It's a program that we can deliver your chronic medications to you for free, and you can save up to 30% on your expenses. This 30% is the terms and condition is basically related to what? It's a combination of your medication cost plus consultation cost. Imagine if you are spending $1,000 a year, 30% is how much you will estimate to save. To know more, you can inquire later. Next offer we're going to share with you is that we are partnering with our panel hospital called Alpha Specialists. They are offering a 10% off their current healthcare medication package. So this package is a special package designed for Health Metrics users. At the same time, if you are Health Metrics user attendees of this session, you get additional 10% discount. Right. The last offer is from Savior of Life, like what Dr. Sean says. Whatever food that you're getting right now, whether it's pre-packed or canned food or whatever food on food stores, you may not get the right nutrition or maybe over-consume with sodium or sugar. So Savior of Life also offer healthy food delivery. So you can see there are multiple vouchers here. For first trial, you have savings up to 50%. If you wish to know more how you can enjoy these savings, do wait for our post-events email that we'll be sending out. That's where you can send in your inquiries, and our team will follow up with you and explain to you how this program works. So for those who are interested in any of these 3 offers that we are doing, just wait for the email we'll be sending out later after the, next week after the event, so that you can submit in your interest and find out from us how you can enjoy this benefit and offer. All right. So thank you both, Doctor, for attending this session and giving a lot of info to our attendees. Thank you every attendees for joining us today. So we hope you stay home, stay safe, and make sure that you eat healthily and have exercise along the way, although we can't go to gym, still can work out at home. All right. Thank you, everybody.
Thank you.
Thank you. Bye.
Thank you. See you guys.